I must do whatever it takes, because he was such a good friend to myself as well, the short time that I knew him toward the end of his life. And then once I got to know his patients, and then Dr. Lazar came over with his family, it was just, I had to do this. I had to go and help. So one of the biggest rewards that I have in my life is getting the satisfaction of seeing people get well. And then once in a while they thank me. And that's really cool. So we're going to be talking obviously about digestive health tonight. And a lot of people think of digestive health much differently, perhaps, than I do. But we're going to go through some facts and considerations. We're going to go through some stressors, some of the top stressors that I see in our office, in my practice. And then we're going to talk about some strategies, some ideas, some things that I think that you can implement. And then we're going to look into why I think labs are really good to have. Because a lot of us in America think of labs as being kind of the gold standard for our healthcare, right? Now, I'll talk about them a little bit more later, but I like to say that's the best of the Western medicine blended. I don't want to say Eastern medicine, because I am not into New Ageism. I am very centered. I am Orthodox Christian belief system. So I always like to explain to my patients that what we're doing is quantum physics, and we're tapping into the design that God gave all of us. And this work actually helps us do that. And then there's going to be a special offer for those that are interested at the end of the night. And then any questions, and hopefully I'll have some answers for you. So about me, this is going to be a really short discussion. 4 kids, very happily married, graduate of Logan University in St. Louis, Missouri, about 30 plus years ago. And I've been doing nutrition for just about as long. I got into chiropractic, and then I got really antsy to do something else. I had taken applied kinesiology in my core studies, and I thought, well, I want to embrace that and really offer that to my patients. So I've been doing that and studying and improving upon the skills over the years, and I never want to stop learning. And I learn from my patients every single day. So you may have heard this statement before. You are not only what you eat, you are what you absorb. Doesn't that make sense? So we can have all the good food in the world that comes through our mouth, the entry portal, but if it's not being broken down, we are going to suffer. We're going to have malnutrition. Without healthy stomach acids in that first part of digestion, after it gets down to the stomach, we can't digest food effectively or fully, or hardly at all with some folks. So there are 3 things that can happen if we have stomach acids that are not there the way they should be. We can have this thing called putrefaction, when proteins from meat or even nuts and seeds come to that area of our digestive tract, and the stomach acid is too high, the pH is too high. So we should have a pH of between 2.0 and 4.0, okay? That's kind of acid, right? We need that to break down proteins. We need that to break down other things, fermentation. We can have carbohydrates that are not broken down effectively. So people that often have gas and bloating, it starts right up there in the stomach area. We can have rancification. Everybody's heard of rancid nuts, right? Or rancid food products. That can happen, and it's basically fats that are not working through that first stage of digestion. A lot of people think of the gallbladder, but it all starts really right there in the stomach. So one of the things that we always look at with every single patient is, how is that first stage of digestion going? How are they chewing their food? Do they have salivary flow in the mouth, right? Does it get down to the stomach effectively? We've had some patients that couldn't swallow, and we had to figure that out. And their body told us, thankfully. But it wasn't, we didn't say, well, go and have your esophagus stretched, because God gave us all esophagus that should absorb, or it should take in food effectively and allow it to travel smoothly to the stomach. So I'm going to talk about some of the top stressors to health, to digestive health. Immune stressors. So we look at immunity always as not being necessarily a sickness, but we look at it as a challenge. We can have an overgrowth of fungus, or we can have a good level of fungus or bacteria, right? So we take probiotics. So we have trillions of cells in our intestinal tract. We have about 100 trillion cells of immunity factors in our digestive tract. The rest of the body has about 10 trillion cells. So you see the complexity of our digestive tract. And each one of you, including myself, has a different fingerprint, so to speak. We have a different blue environment in our digestive tract. So everybody is a little different puzzle. So if we come along and we say, well, you maybe have a fungus infection, take this probiotic. It might not work for you because yours is different than the last guy that you know of that it worked for, right? So we have, bacterial overgrowth. We check for that. We check for viral challenges. We check for fungal and parasitic challenges. A lot of times folks think of parasites as necessarily being really horrible things, but I see them quite common with a lot of folks. It's not that the parasites all of a sudden came in and infested their system, but a lot of times the system was right, or the milieu or the environment presented itself where something in the very, very seed form could grow. So we microparasitic, okay? So that's often the case with our whole system. Even cancer cells, I believe, are within everybody. It's how our body suppresses that, how it manages that. I won't go down that rabbit hole though tonight. Then we also have chemical challenges, airborne chemicals. I often ask myself, how did this patient get this? And they ask me that, of course, too. And we live in an environment where a lot of these things we can't even taste or smell or see what we've breathed in, or what we've absorbed through our skin, what we've had on the foods. Even that fruit tree, when it's growing, when it's sprayed in the spring, it hits that blossom and it goes right into the core of some of those fruits, right? So depends where that fruit, where that vegetable was raised, what's going into that after harvest, how is it processed to preserve the food, right? All those factors. Personal care products, we often think of things that are really caustic, but when I look at a tube of toothpaste, I'm looking for words that I can't pronounce. That's what you guys should be looking for in everything that you put on your body, right? A lot of the things with soaps and shampoos, sodium lauryl sulfate, some of those common things that I see heads nodding, those things can absorb right into our skin and affect our overall function and even our digestive function. Contact through the environment. So we can walk through the grass and not even be aware that somebody has sprayed pesticide there 2 days ago, or something else to help the grass grow, maybe, or all these other things that are in our environment. We can walk into an office building first thing in the morning for an appointment, and they've sprayed there the night before, that very morning, very early, for insects, perhaps, right? So we don't necessarily even know where some of these things come from, but why really worry about that? Once we identify, then we look for natural detoxos to pull that out, help your body push that out. Heavy metal stressors, much the same. We don't really often know where they came from, but my job is to identify which it is. Then we track it, and then we look and see how we can help the patient get rid of it by natural supplements or natural detoxos, homeopathics, etc. I put on the bottom there inorganic supplements because I've had a lot of patients that have come in with different forms of minerals, especially that are from an inorganic source. So their body has actually taken on a heavy metal They can have a zinc overload or an iron overload because it's not from a natural source. Of course, we need those elements in our system to work correctly, right? So you need certain amounts of minerals in your digestive tract for that digestive tract to function normally. So when we look at labels, oftentimes we don't really know what that supplement's going to do to the patient either until the patient actually brings that supplement into me. And I say, hey, that looks great, but how about you bring it in on your next visit? I'll get text messages, hey, this is great, I found this. And can you tell me it's going to be good? Looks wonderful, but we don't really know till your body gives the thumbs up or thumbs down on that product, right? Food sensitivities. Most patients are not allergic to a lot of foods. Most patients, however, are sensitive, or their body has a hard time processing, or they'll get some sort of symptom reaction that they don't necessarily associate with the food that they're eating, okay? So most patients, as they grow older, especially after the age of 40, don't have enough enzymes created internally, because a lot of us in America have messed up what our bodies produce. All the organs of digestion, the pancreas, the gallbladder, et cetera, are not doing fully what they used to do. We could get away with it when we were maybe a teenager in our 20s or 30s. And a lot of folks can't, even that age, because they're eating such terrible, terrible diets. So a lot of patients may not have digestive upset when they eat something that's bad for them, but they'll have maybe brain fog. They'll have lack of energy afterwards. They'll maybe have an unexplained skin rash or some other symptom that they often think, well, I need to go to a dermatologist or some other sort of specialist. And it's just that their digestive tract is having a hard time, and there's a toxin or there's something inadequate within them, inherently an enzyme deficiency, that they're not able to keep up with the blending of the foods or the specific type of foods that they're ingesting. Scars. A lot of people don't think of scars. You're thinking, wow, how scars? But did you know that all of us have this map on the outside of us called the dermatome? So derma meaning skin, and tome meaning kind of a map. So when you look at that in a physiology textbook, dermatome mapping identifies what part of that skin has feedback to the internal organs within us. Isn't that interesting? Yeah. So if you have a scar that's going across one of those dermatomes that has feedback through the parasympathetic system, which has a lot to do with digestion, that can interfere with that part of your digestive tract not functioning correctly. We've seen scars. One second with your question. We've seen scars that are decades, many times old, from childbirthing with a lot of females. Wait, I had my first child at, I was 20 and now I'm 70. Doesn't matter. When they work on that scar, it's remarkable. Not only does the scar maybe improve in its appearance, but the physiology is improved. Do you have a question?
I was going to ask, is it more like the center of the body? I feel like I was I don't think I
both can be. Yeah. Both can be, but I see it more commonly with center of the body, especially right through the center, especially when a lady has had a C-section or a birthing scar from vaginal delivery, episiotomy. I will see that pretty commonly. Any sort of surgery that's cutting across, sometimes we can get by with the scars or the injuries that are going longitudinal, but cross scar interference, that's often a problem. Piercings, tattoos, the skin can often be interfered with through tattoo procedures that go too deep. So it'll usually be the darker colorations in the tattoos that cause interference. So let's go through some of the organs and glands of digestion. And some of you may have not even thought about some of these. pituitary gland. I'm sure you've all heard of the pituitary, right? But the pituitary, one of the big things that it does is that it controls the timing, secretion, and the amount of secretion of salivary acids and digestive acids into our stomach. Okay, so oftentimes patients are put on Prilosec or omeprazole, some of these drugs that shut down what this proton pump inhibitor is called. Okay, so what it's doing is that it's treating really the symptom, right? It's not getting to the cause. Okay, so we're all about cause, because when you interrupt that first stage of digestion, everything down below that doesn't work as efficiently. Okay, you're going to have digestive problems that you may not have identified with that will show up 10, 15, 20 years later. And I even think colon cancer could be part of that whole process. I don't want to say adamantly that any of these things are the cause of cancer. I believe cancer, this is a little bit of a side, are a whole bunch of factors, and it's individualized with everybody. Okay, I didn't want to scare anybody or anybody online that is thinking that we're saying X is the cause of cancer, which is really not what I'm trying to convey tonight. Salivary glands decrease secretion will interrupt. So my dad was really big on, you've got to chew your food 30 times with each bite. And of course, we never did, right? It was as fast as we could get it down, and as much maybe, because I had a big appetite when I was growing up, because mom was such a good cook. That, you know, and then the other thing, we wanted to get outside and play and all the good stuff that we were doing. So sit down, enjoy your meal, let that parasympathetic system really be engaged, so you're not, you know, we're driving down the highway with a cell phone and a sandwich in the other hand, and, you know, trying to beat the horn with your elbow to people that are in your way. You know, it's probably not a good parasympathetic picture, right? So we really need to chew our food, and it's really hard. We really can get so much nutrient absorption out of that food, and also you just might enjoy the food a little bit better if you're chewing it. Looks like my remotes. I don't know, the battery might be. Yeah. Does that go up? Is that what we're doing? I'm moving my left and right arrows here on the keyboard. I'm sorry? There we go. It's not working either. Oh. There we go. Thank you, Tech. All right. So we talked about low and high stomach acids, constriction of the esophagus, hiatal hernia. Does anybody have a hiatal hernia? Heard of that before? Yeah. Yeah. So that's basically a blockage where the stomach comes out and empties out into the small intestine. So that's the door from the stomach. That's the exit channel out. Sometimes that can be a mechanical problem. So it can be something that could be adjusted, but oftentimes it's a problem with not enough stomach acid. So that food becomes almost a bolus, and it forms almost a ball, a big ball there, and it can create a lot of distress, right? So it's not being broken down fast enough. Ulceration in the stomach and duodenum from lifestyle problems and maybe other stressors in their diet, etc. The duodenum, the next part of this of our digestive tract, small intestine, enzyme deficiency. A lot of times the pancreatic enzymes are off, so we're not getting that input from the pancreas and the gallbladder into that area of the intestinal tract. So that's very, very big in America, I believe. Gallbladder, bile duct. A lot of folks have had their gallbladder taken out and they've been told, oh, you don't need that anyway, you'll be fine without it. But it's very, very important. Breaks down fats, helps you with digestion of meats. It's very, very underrated. So he did a study, and I've seen the study, that those that have had their gallbladder taken out have a higher incidence of colon cancer, so lower bowel cancer is increased. So the gallbladder, if you don't have one, we want to make sure that we're treating the liver very well. So that function through the liver, bypassing where the gallbladder once was, is emphasized. So bile is one of the most powerful antioxidants to our intestinal tract. So antioxidant, meaning anti-oxidation, which is turning into free radicals, which turns a lot of the bacteria and the organisms into working against us, okay? Tearing down, causing ulcerations, causing all sorts of symptoms, but ultimately dysfunction and disease, okay? So all disease really is an inflammatory and oxidative process. That's where all disease really ends up coming down to those processes, right? Aging. So you think of aging of metal is rust, right? What do we need for rust to form? We need oxygen. So oxidation, okay? So insufficient pancreatic enzymes from the pancreas. We have a lot of patients that will maybe have loose stools, or they'll have bloating, flatulence, those sort of things. Pancreas could be part of that. A lot of us think of pancreas as only being sugar, right? Sugar regulation. Most people don't think of the pancreas as being really important in digestion, as it is. I am very much into holistic cancer care through this office and through another office in New York City. And the work was developed by Dr. William Kelly in the state of Washington decades and decades ago. He's gone now, he's lived a long life. But one of the things that he discovered through his research was pancreatic enzyme therapy at high doses would often help. And he had the longest life and longevity for those patients with pancreatic cancer than anybody ever known. The NIH, the National Institutes of Health, saw what he was doing, and they said, "Hey, we want to know. Let's do some research. Let's team up with you." But once they discovered that his stuff was all about natural and enzymes and whole foods and diet and doing everything the way that it should have been done, they weren't interested. They defunded the study. Yeah, it was millions of dollars and he had this study and he came out with it. And for some reason, they didn't like it. Maybe it had something to do with the huge amount of money that the pharmacy industry has invested in that, right? So the pancreas is extremely important in our digestive health, as well as our sugar balancing. So strategies to improve digestion. Labs will not do anything for us except tell us where we are, right? Patients will often ask me, what can I do diagnostic-wise? I said, diagnosis is great. We need to look at all the tests we can, if they're valid, if they're not, just running up your insurance bill or your healthcare bill, okay? I think that labs can really tell us a lot about your overall physiology. I have a set of labs that does not spare on seeing what all the players in the orchestra are doing. I have so many patients that I've seen over the years, they brought in what they were told was a complete set of labs. So they were given a CBC, which is your white blood cells, lymphocytes, basophils, eosinophils, et cetera, et cetera. So the immune factors, which really cost probably about 10, 15 bucks, okay? And then they were given some cholesterol numbers, HDL, LDL, total cholesterol, And they're maybe given a glucose reading, HA1C. Oh, these all look good. You're good till next year. So our labs, we've seen probably 90% of the folks that come in, the labs that I think are important to us have at least 50% more data than what they're told they needed. Okay. Do you think that's fair to them to not tell them the information because the insurance company wouldn't pay for the code that they build in there? No. That's the little secret behind a lot of practices. They're ordering based upon diagnostic procedure codes, and they have to fit into these bubbles and these boxes. And that is not healthcare. That is really doing a disservice to the patient. I would rather tell a patient, these are the costs of the labs. If you don't do them, I'm flying blind and I can't help you. I would rather tell that patient the truth. Okay, we need these, and we're going to go from these, and this is our baseline. I had a friend once that was severely overweight, and I said, "Hey, you want some easy answers from me, but this is what I see, and you need to do this, this, and this. And I'm sorry, you may not like me tomorrow, but this is lifestyle. And if you don't do this, you're probably going to be dead by the age of 50. He turned his life around. Within 2 years, he lost a ton of weight, and his energy and everything came back. And he said, nobody has ever done that before. They've always sugar-coated. They've always played around the edges. Oh, take this drug for this symptom, or take, cut back on calories, count your calories. What we want with all the patients for them to embrace the lifestyle, know what foods they're sensitive to, and know how to cook. So that's really, really important, or find somebody that can cook or know how to shop. And that's some of the discussions that I have with patients all the time. So labs will tell me what's been done when I redo them and what I haven't done right. I'm the first to admit that, hey, your body took this and interpreted it maybe a little bit different. But thankfully, we've got improvements in all the labs and most of the things that we work with. But we never promise that we're going to improve everything all at once, because it takes time with a lot of folks. So my NRT testing is the next thing that we do to improve the health of our patients here in the office. So the NRT testing shows all of the interferences, shows the stressors. And what I'm going to do is talk about foods and some of the stressors from that standpoint when I test one of my assistants here. And I'm going to give you a demo of what Laura is sensitive to. So what is NRT testing? A lot of people, they see it for the first time and they think, wow, that looks kind of weird, right? It looks kind of hocus pocusy. So that was my first reaction when I first started doing applied kinesiology, then NRT work, as I thought, wow, I want to get up there. I want to be tested, because it looks like he's pressing on her arm or his arm a lot harder. And what is that? What is that stuff that he's putting up against them? What are those test files, right? So what I did was I actually started getting tested, and then I embraced it. I said, I want to learn this for my patients because I see the tremendous things that it's done for me, and then my family. So I'm never willing to do anything for anybody else that I don't do on myself. So I don't want to look bad. I guess that's part of it, right? So what I'm going to do is just briefly show you what NRT testing may look like with an average patient. So usually the patient is on their back, so they don't have to fight the effects of gravity. And what I'm going to be doing is going up against the pineal gland right here between Laura's eyes. The back of my finger, we call a negative, and she's putting out positive right here. So as I press, a negative positive magnet response is strength, right? So as I press down, she's steady. I turn my finger over, and there's a positive interaction. And was that easy to hold up? Here it is. And is this easy to hold up? No, okay. That's okay. I didn't phrase the question correctly then. Okay. So when I come over different organs and glands, reflexes related to what's going on inside of her, then her arm is going to remain strong when she has no problem with my body pressing on that reflex point. Okay. So if I come over Laura's thyroid gland right here, it remains strong. If I go over her stomach point here, she's wimping out. She just loses all strength, right? You're not a wimp, but that's what happens. And I just had a patient ask me today, wait, I wasn't ready. It's not about being ready, right? So I say, well, let's show you this. And I went through that again with the strength and the weakness. And I said, we measure EEGs, brain waves, right? So there's electricity with the brain, EEG, electroencephalogram, EKGs for the heart. All we're doing is we're accessing the body's electricity through these points, okay? We call them breaker points or reflex points. So if there's stress there at one of those points, if the body's not functioning when we press on that, then her body says, hey, wait, I'm going to forget about this deltoid muscle group in her shoulder because this is really distracting me because it needs help, okay? The same happens when I put up against her one of these foods that are, the energy is imprinted into the purified water in each of these vials. So it's electronic energy signature. This one, I think every single one of you would have a problem with. What is it? White refined sugar, okay? And if you doubt me, come up to me after class tonight and I'll put it in your hand and we'll give you something that probably will be pretty healthy for you, maybe tomatoes or something else that you're not sensitive to, and you can see the difference, okay? It's really cool, okay? So that's how we do. So then when we have, so if her stomach was the priority, so to speak, so the exam we go through, we find a bunch of things, and there's this priority thing that I would do to see what the body wants help with first. I could say, well, she has all these symptoms of gallbladder, but it might be small intestine, it might be pancreas, I don't know until we test. So we put her in that mode, and then I'm checking, say hers is stomach, and then we put up against that different products. Now, if she's in a weak mode here, and I put the stomach, the white sugar vial in her hand, that'll change the response, okay? Or I can just simply put up against her the substance, okay? Now, if she has a problem with this one, I'd be surprised. That's fruit sugar, okay? Now, if she had fruit sugar, yeah. So if she had a fungal problem, if she had an overgrowth of yeast in her system, that yeast likes to gobble up fruit sugar many times. So that might be a problem for her, okay? Or parasites. So
fruit sugar may or may not be a problem for them.
That's correct. Yeah. And really in America, we consume way too much fruit. I don't know if you remember your grandparents, they used to get an orange for Christmas. It was a big deal. They get one piece of fruit or something similar to that. Maybe they had a little bit more money, they got two oranges, I don't know. But we have way too much fructose, really, for most of us, that we have, we have a whole bowl of strawberries and blueberries, and go back to the breakfast bar and get a bunch of muskmelon and cantaloupe, the honeydew, all that stuff. Great if you're just doing a little bit at a time. But what does that do? The pancreas has to handle all of that. Okay, so I don't want to go down that road too far, but fruit sugar, a lot of these things are wholesome. Thank you very much, Laura, for your help. They're very wholesome and very good for us on their own. But some folks, they have a reaction tomatoes, okay? And we have, nightshades in here, so that's a group of different foods, right? Different vegetables that some folks can't handle, they're sensitive to. The good news is you're not sensitive forever many times. I will never say that about white sugar, though. Really can't get away from that one. Man-made process, refined, anything that's here in the kit, we're going to strongly discourage, and your body's going to agree with it through the testing as well. Okay. So I brought this kit out because this is an interesting kit. This is a special situation kit. So if anybody struggles with diverticulosis, IBS, different things for specific digestive functions, we have an app for that. Okay. We have tester vials for that. Okay. So what we do is we put that app, so to speak, right, the tester vial on that patient to identify that they indeed have been given maybe the right diagnosis. And I'm not going to diagnose or treat any disease. We're just interpreting what the body is. And I'm simply here to balance. Okay. Then we let the body do the treatment on its own once we give it the tools to balance. But when we see those things, I like to make sure that it's not just a diagnosis that has been given falsely, number one. And number two, I want to see how that progresses as we go. Because some folks have been told, oh, you'll never be done with that. You'll have to take this drug forever. And I've seen a lot of folks, as we work with them, with the cooperation of their other physician, being pulled off of Prilosec and some of these other drugs that they were told that, oh, if they don't keep on them, they're going to get Barrett's esophagus and, throat cancer and all these different things that, maybe the medical doctor in good faith has been trained that that's what's going to happen. But a lot of them really don't know anything about natural healing and how the body works once we give it the tools that it needs. I am always amazed at what the body can do when we give it the right tools. There's a case that I always like to bring up, and it gives me goosebumps every time I talk about this case. But his family referred their husband and dad in to see me because he had been told that he had he had to have a surgery on an aortic aneurysm. And so I thought, this was several years ago, I was young in practice. I thought, oh yeah, well, let's see what happens with this one. He's probably going to need the surgery after all. But I said, yeah, I'll take the case on. Let's see what happens. A few weeks into the case, he'd done everything all right. He'd been doing really well with his diet, with his supplements. Family came in, they said, yeah, the other doctor, they want to do some contrast imaging. I said, yeah, I don't really like some of the exposure and the contrast barium and all this stuff but I said, I'd really feel badly if something happened to dad and, your husband, if I don't say yes. Because I was like it for them because I had helped the family. And so whatever I said, they were going to do. But I said, yeah, even though I don't like it, go ahead and do it. And we'll have to detox from some of the effects of the imaging later. So he went and did that. And then a few weeks later, his wife came in. She had tears in her eyes and happened to be up by the front desk, not this front desk, but another office. And I thought, oh, what happened to Dale? I thought something terrible would happen to him. She says, I just want to tell you, we have so much thankfulness for this type of healing because he went for that imaging study and there's nothing there anymore. And I said, praise the Lord, thank the Lord. And that was the moment that I took what we do here so seriously. I thought, this is powerful. When we give the body the tools to remove and put out the inflammation, and then give the body the tools to repair, the power that made the body can heal the body. And we were given these tremendous organisms, and we just have to tap into the healing abilities of our own body. So that's what NRT means to me, and that's what hopefully it will mean to you guys. I know that I have one patient in the room tonight, so he already knows what it means. But the supplements we give are, to optimize, and they're specifically tested. I'll say no more on that. We did the NRT demonstration. Special offer for anybody here tonight. I really want each of you to go into whatever health situation you're in with eyes wide open. I want to have labs. I want to discuss what's going on, and I will hold back nothing, right? We want to make sure that you understand where we're going when we find whatever we find. And it's teamwork. It's not me. I'm just kind of a director, and I kind of show up and tell you what you need with the testing. But ultimately, it's you. And what's so gratifying about that is our patients, they get the biggest euphoria over the successes that they see that happen with them. It didn't think it was possible sometimes. So complete labs and NRT testing and reported findings, 2 separate appointments. We're doing tonight for $397 instead of the normal $497. And we would like that appointment to be prepaid and scheduled tonight for you to get that locked in for you. So $100 is nothing to sneeze at, right? So, but I think you're going to forget about the $397 long after you've seen the results with what we're doing with you. Okay, I'm going to open it up for Q&A. Does anybody have any other questions? Yes.
Funny. I left the meeting and I'm still in the meeting.
I can't, they just call it separation.
Dermatitis, yeah, yeah.
And I've had it since I was in, I've had it comes and goes.
Mhm.
But it, I mean, it's had a long days.
Absolutely. Yeah.
So it's like, they don't really know what to talk. It's like, well, it's like cortisone,
Sure.
so,
Hydrocortisone basically just kind of a Band-Aid, right? Suppresses the symptoms.
yeah, so.
Yeah.
I don't know.
Yeah, I've seen something as simple as food triggers, along with maybe one of the other immune challenges, be the culprit with those. I don't know till we check. A lot of times I'll see parasitic, fungal, yeah, and a lot of times we'll need some of the exit channels opened up. We may need the colon, something going on there, or the kidneys to help flush out the toxins as we go. Your body oftentimes will put through the skin what it's not able to pass out through the normal exit channels. So we breathe out, right? That's a cleansing mechanism, our lungs. We have the skin, we sweat out, and we have the urinary tract and the colon, the digestive tract, right? Put out. So those are the exit channels. But often I see with skin issues, it's kidney problems, as well as some other sensitivities. And one of the stressors could be, 4 or 5 of those. I don't know, so we would check, yeah. And, a lot of these things are autoimmune. So when we're looking at autoimmune conditions, oftentimes one will lead to another. And I don't use that as a scare tactic, but a lot of times we'll see somebody like with Hashimoto's thyroiditis, and then if they're not addressing that, then they'll develop another type of autoimmune condition as they go on. So nipping it in the bud is really good. And finding out what's the trigger always with that, yeah. So the lotions and the potions and the salves and the creams, they're all just kind of a Band-Aid. You're not getting to the cause.
Yeah, I mean,
Yeah.
it goes away. But it always comes back.
Mm-hmm. And sometimes you'll be going even through, I've heard this, I didn't get as much sleep, or we had a lot of stress. And then, there's different factors, of course, that trigger those up and down skin reactions. So yeah, great question. Anything else? Yes.
So what does it look like after you do the
Yeah.
What are you looking at? It's like
Yes,
treatment plan.
yes,
What would you expect beyond initial two tests there?
yes,
What that means,
yeah, right. I would like it to be as long as I'm alive anyway. Yeah. So I'm sure Dr. Lazar has told you, and rightly so, that when you start feeling good in your spine, do you just quit? I mean, you're probably going to have your spine for the rest of your life, right? And that's kind of a trite answer, but the more I see somebody, the less I see somebody, just kind of like in chiropractic. So what I do in that first year, I do another lab at 6 months. I do another lab at 12 months, identical labs. Now, if you have a concern about prostate health or something, then we would do a free PSA and a normal PSA, that combo. That's just a for instance. I'm not saying that just because you're a man, but there would be maybe add-on incidentals if somebody has an issue. We certainly don't want to say, well, go see your medical doctor for that. Now, I do encourage my female patients to go through their OBGYN for some of the female, at least the diagnostics. So I'm not going to do a pap smear here or anything, or you have, we just don't do that. But then the visits, the follow-up visits, we're looking at where you've been. There's a scoring routine. And so we take it layer by layer. So right now, I have several patients who are every 3 or 4 months in between. And some patients, they're acute. So I would see them every week. So the better you behave, and I don't mean that in a bad way, but the better you embrace the diet plan and the supplements, the less I'll have to see you in the short run and long run, both. But there is a plan, and I go over each individual plan with everybody. And if you're looking for, frequency and dollar numbers, I couldn't honestly give you that. And I would tell you that, when we did the exam and everything at that point. Yeah. No, but HSAs and flex plans do. Yeah. The labs that I deal with, what we get, because I'm a co-op member in the lab. So what you're getting with that lab is, if you went and shopped elsewhere, it's probably going to be at least twice as expensive. And then when the insurance companies get a hold of labs, they'll like, it's out of sight what they bill, or the hospitals bill insurance companies. I don't apologize for the pricing at all, and I know, but it's too bad that they don't cover, and I don't know if I even want to get involved with that game. It's just, because they dictate how doctors make decisions, and that's really, really sad. It's not the old Marcus Welby MP that we saw on TV 40 years ago. Has anybody seen that show? Yeah. So, any other questions? You are?
Oh, yeah. Oh, yeah.
I know that.
I know you know that. My family doctor used to make supplements. So
Yes. Yes.
all kinds of shit. He also
They
does
have. Yeah. Home calls.
phone calls.
Yeah. Yeah. I have done that for very special patients if I haven't overbooked myself. And yeah, I don't want to overcommit, but I've had some of those situations that they're like family, and you just have to, and
What do you think about the budget?
great for most people. Yeah.
Does that help with the acid, stomach acids?
Yeah, it really depends how your upper GI is set up. But yeah, normally anything that's a probiotic like that is going to be well received. I don't like introducing probiotics until inflammatory things have been cleared out. So a probiotic is more of a builder. So we like to usually remove interference first. Yeah, those too. Yeah, we have some, real need for prebiotics as well. Yeah. So there too, we're looking at when to introduce them. I never liked really bringing in the carpentry crew until the fire is put out. That makes sense? Yeah, there's so many people say, oh, take a probiotic. And they come and say, well, I've been doing this for 4 years and I still have symptoms of the condition. Or they go to the health food store and, oh yeah, this works for this, and it might be, but it maybe was the wrong product for them. That's why in my testing, I'm pulling out 4 or 5 different options of something that's going to work maybe to remove parasites. I don't know what your body's going to test with. That's the beauty of the muscle testing. So that's really, really cool. One thing that we strive to avoid is using supplements that are not whole food supplements, that are not organically farmed in their production. So there are a lot of companies that take shortcuts. We try to deal with companies that have those standards, plus are not going to, exorbitantly overprice their stuff. We'll see that with some of the multi-level marketing companies that patients bring in. They'll say, oh, I paid $100 for this little thing of powder, and our supplier and our retail pricing on that is about a quarter of what they're paying. So yeah, there's a lot of stuff that goes on in the supplement industry, which I don't necessarily agree with that way, unfortunately. And people, they are well-meaning. They say, yeah, this stuff is really good for your immune system, but it's I don't want to say dishonest, but it's overpriced some of it for sure. Any other questions? Mold and fungus, kind of in the same category. Yeah. So I have actually had patients bring in samples of air, samples of fabric, things out of their home if they suspect there's a mold problem in their environment there, and or workspace for their office. But a lot of times it's something that they've ingested or something inherent in their system. So we can pull it out, but we want to know what we're dealing with. I have a kit that has a bunch of different species of different molds, so we can kind of track it that way too. So yeah. Yeah, there's good yeast and there's bad yeast. So there's a nutritional yeast, right? Just like the kombucha, right? So there's some of these things that will feed the good guys, the good yeast. And there's obviously there's toxic, very dangerous stuff. So yeah. So fruits will feed, as I mentioned earlier, the bad yeast or the parasites, etc. All right. Any other questions? I don't want to shut it down before you're done asking. I'm out of almost all the good answers, so All right. Well, thanks for attending. I really appreciate you guys, and I hope that I can get to know you better and to offer, let Casey or whoever's up here. Casey, yep, there she is. She can handle pricing, scheduling questions. Usually labs done first thing in the morning when you do those, so you can get to the rest of your day without feeling like you're starving, because it is a fasting lab. So try to get there and do that first thing in the morning. And they will ask for a urine sample too, because I want to see what's going on with a little bit of that. So drink a little bit of water before you go to the lab. And it's all downhill from there. So I look forward to working with all of you who are interested, I put it that way, motivated. So, thanks again for coming. You're welcome. I could talk all night, so thanks again. And for you online, I don't know if you're still there. Thanks for attending. We're kind of done. Try not to watch it.